look at some low-hanging fruits that we can use temporary for. Number one, we must, as a matter of priority, classify nationally GBF-related workers as essential workers. The essential workers, the emergency workers, they must always have the access to be able to provide services to all the people. Number two, when you think about a GBV survivor, she's been beaten, sometimes she'll be driven from her home, and you're talking about health services. How on earth will she find the money for services? And therefore, when we think about offering free services for family planning, we think about offering free services for people in the humanitarian setting. These are people who are in the humanitarian setting. And therefore, as a matter of policy, we must think about free treatment policy for all victims of GBV. Thank you. Number three, capacity building for health workers. Health workers are the center of providing services. And if they have not been trained, they've just not been trained. We saw a number of states training health workers during GBV, during the COVID-19 pandemic, but that is not national. And so we need to look at systematically building the capacity of health workers on GBV cases and integrating into the curriculum of our medical school, nursing school, and all our health training schools the whole issue about GBV and survival center services. Number four, we cannot treat GBV as a standalone service. It must be integrated across every sector because this woman will provide with different dimensions of issues. She needs mental health services. She needs physical health services. She needs social support. So we must integrate GBV care into all healthcare services and ensure that they meet the minimum standard prescribed by our national guideline. Number five, we must scale up the response management system to be able to document, analyze what is happening, and use that to build our system. Number six, we must also intensify demand creation. Many of the women who have experienced violence in Nigeria never saw services. That must change, and that needs to be changed if you need to help them. And therefore, we must look at how do we behavior change communication to help these women to understand that services are available, and they need not be ashamed because it was not their fault that they were abused. So they need to be supported, they need to be strengthened, they need to be encouraged to see services. And finally, we can do all the talking. If we don't, as a nation, commit resources to this agenda, then we are jokers. We must commit funds, we must commit resources, not on a stopgap measure, but on a sustainable measure. And it's not just about creating budget line. It's always so convenient to create budget lines. And then you create a budget line where there was never budget allocated, and when they are allocated, they are never released. So we must think about sustainable financing, think about creating budget line, ensuring budget release, and ensuring that budgets are not only released, they are also implemented, and there are accountability mechanisms to ensure that they actually bring the results for which we have said them. And let me say, it's so good to talk about survivors. Quality care for survival is imperative, but the prevention is fundamental. Otherwise, you'll be like you are opening a tap, you are not closing the tap, and you are busy mopping the water. So we must look at prevention as a critical element as we go forward. In that respect, we must strengthen community system, our traditional leaders, our religious leaders, for GBV prevention and to change the social norm. We must strengthen the coordination and the network of women organizations and NGOs for GBV-related activism. Number three, we must intensify behavior change communication, not only for men, and not only for women, but also for men and for the boys, to create gender equitable norms and ending violence for all. Violence also affects men and boys, but women definitely are more affected and they need more priority. But we must think about ending violence against all in our nation. Number five, we must adopt and rigorously implement our relevant laws and policies nationally. There are states that have not yet adopted the policy on child rights. There are those who have not done that for VAP. We all must get all of them to adopt. And beyond that, adoption does not suffice. We must see implementation that will bring the result. And finally, we must capacitate the younger generation through inclusive and skill-oriented family life and health education programming and also mentoring. I would like to say, as I close, if gender-based violence is a public health challenge, then public health professionals must be in the forefront of challenging that challenge. And if public health professionals are to act, then the public health physicians, who are the topmost experts in that field, must be seen playing leadership role and must lead this entire process. And I will close by suggesting 5 things that I believe we must do. And I've titled them A, B, C, D, E for the public health physicians. Number 1, A, advocacy and activism. We must become the loudest voice in this nation against gender-based violence for the sake of our women and for the sake of our children and the future generation. Number 2, B, must build capacity, both pre-service and in-service, to ensure we are able to respond not only clinical care, but also prevention. C, community-based actions and clinical care. D, development of policies and programs. And E, not only development, but also evaluating those policies so we can know what works and what does not work. On this note, ladies and gentlemen, I want to say to us, gender-based violence ought all, either directly or indirectly, and it benefits no one. It's time to end gender violence in Nigeria. Let's work at it together. Thank you very much.